Welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer Dusablon, your host for today's show. Franklin County Home Health Agency is a nonprofit home health care and hospice organization that has been serving people of all ages throughout the 15 cities and towns of Franklin County for over 40 years. Through this show, we bring you information about the agency's programs and services, as well as helpful tips to help you and your loved ones stay safe and healthy at home. On today's show, we will be talking about the agency's worksite wellness programs. Franklin County Home Health Agency is proud to once again be one of the recipients of the Governor's Worksite Wellness Awards, which will be given out this March. So we are proud of the efforts of our staff committees and of our collaboration with community partners for worksite wellness. We have broadened our horizons when we look at wellness at Franklin County Home Health Agency. We aren't only focusing on the physical and nutritional aspects of wellness, but we broaden it to include other pillars of wellness, such as career well-being, stress management, financial stability, and community wellness, as well as social wellness. So this is a trend that agencies nationwide are seeing. It's different than what's been done in the past, where the model used to be a focus on a chronic disease and then focusing on eating well and moving more, and not smoking to manage those diseases. We do recognize those as important aspects of wellness, but we have included more, and we are here to talk about the other things we're doing at Franklin County Home Health. So I have two guests with me from Franklin County Home Health Agency. Traci Osterhoudt is one of our medical social workers. Thank you for being here again, Traci. You've been on the show for talking about social workers and other activities. And a new guest with me today is Deanna McFadzean, but Dee Dee, we go by Dee Dee, right? And Dee Dee is a medical billing specialist at Franklin County Home Health. So thank you both for being here.
Thank you.
And I've invited you two because you both are parts of our wellness committee and other committees at the agency that focus on wellness. So thank you for sharing some of that information with us. But before we go there, let's just hear a little bit more about yourself and what you do at Franklin County Home Health. Traci?
So as you said, I'm one of the medical social workers at Franklin County Home Health, and I've been at the agency for about 13 years. So I get the opportunity to visit with people in their homes and try to help get resources and services in place so that people can remain in their homes where they want to be.
Wonderful. Thank you for that work.
Yeah.
And Dee Dee?
I've been at Home Health for 12 years, and I am the medical billing specialist. I process the Medicaid claims, and I'm also a hospice volunteer.
Oh, wonderful. That's true. Yeah, good work there. So, Dee Dee, you have been there for 12 years and 13 years, and I myself have been there 20 years. One of the things, would you agree, that keeps people there is this culture of a family. We always call it the home health family. Mm-hmm. And tell us about something that you've done to really improve that culture and bring connections with staff. When we think about wellness and those 5 or 6 pillars I mentioned, that social well-being and career well-being is so important. And you've come up with a program. Tell us about that program.
I've come up with a Caring Hearts and Hands program, and what it is it's recognizing staff, and also our clients recognize our staff as well. What the program is anytime that you see somebody doing something like awesome or above and beyond, then they write up a card, Caring Hearts card, and it has information, and it just tells you a little bit of what you caught the staff doing. Mm-hmm. So it could be something like they did something like brought in a lunch for you, or they had chocolate that they brought in for you to last the day. Mm-hmm. Or it could just be somebody has taken over a shift for you, or if there's a hospice family in need and they need respite, it's somebody that's gone in to care for that person's loved one. Mm-hmm. And then simply just fill out this card, and then you get recognized. We have a committee, and monthly we meet, and with the committee, for your first card that you receive this Caring Heart pin. And then you can put it where it proudly...
Traci has a badge, and she has a lot of pins on there.
But I have my Caring Heart pin.
Yeah.
It's a nice thing to show off and talk about what it is when people see it. Can you read us what it says on the card there?
It says, a helping hand. Whenever the need arises, you're always there to lend a hand, taking time away from your own busy schedule to make things better for someone else. You take pride in reaching out and seeing other people smile. Your giving spirit brings out the best in all of us. Thanks for lending a hand.
Isn't that nice? Yeah.
And what we also have is when we are reading our cards monthly, if a card is a wow factor, we choose one person and they receive our thank you Caring Heart and Hand water bottle. So we get together with that person and take a picture, and then it goes into our staff connection. So it's just a great program.
How long has this been going on here at the office?
It'll be 3 years in March.
Yeah. So also talk about how the visibility of the cards.
For the cards, we make copies of them and we put them in the St. Albans office as well as the Enosburg office. And then the actual card itself gets given to the recipient of the card.
Yeah. It's wonderful. I can say myself, like, I love, they're right there. As you walk into our office, if anybody's visiting home health, you can see these cards, and it's so fun to read and see staff members thanking each other or really saying, hey, I heard you did something really great with a patient, or there's patient families who receive these cards sometimes and write them out and send them in. So it's really a great recognition program, and thank you for taking the initiative to bring that to Franklin County Home Health. It's been a lot of fun.
I think many of us carry them when we're going into people's homes. I know I've given them to family members who have expressed a lot of gratitude for things that staff members have done. So it gives the families and the individuals a chance for their voices to be heard too, and recognizing and saying thank you.
Yeah.
Thank you.
That's really great. Thank you. So that's the Caring Hearts and Hands program, and like I said, that really impacts career and social well-being and gives us a chance to recognize each other, which is so important. Another aspect of that career and social piece is the Spirit Team. And talk a little bit about what the Spirit Team is at Home Health. We don't have an actual member of the team here, but we all benefit from it, and we have team members, staff members who work on a committee to bring us fun activities such as.
So the Spirit Team does activities throughout the year, different things. They do goodie bags for our staff so that we have nutritious snacks for when we're on the road. They've done flowers for us. We've planted, they brought in seeds and we've planted flowers. They've done pumpkin carving for the holidays. They made, most recently for December, had gone through and made ornaments that we could all take. Barbecues, yeah.
Anything with food.
Anything with food.
Brings people together.
Yeah, we've had pumpkin carving contests and pumpkin recipe contests and soups. Yeah, this would be a good time for those. So yeah, that's a fun team. It keeps the morale high, keeps people doing just something fun once a month, about once a month or so, and engaging.
Keeps everybody connected, and that's part of the family feeling at Home Health, is making sure that everybody is feeling connected.
Yeah,
so
absolutely. Yeah. And another committee, again, that we had invited one of the leaders of that to come, but she's busy today, but is the safety committee, which, is something that we've always had. It really focuses on staff worksite safety as well as patient safety and caring for your patients, but we really realize that is part of the wellness component. So we've put that under our wellness umbrella model at Home Health. But can you talk a little bit about the safety committee and the kind of things that safety committee has brought to the agency?
Well, we've recently with the safety committee, we had like different drawings, and we gave out the emergency car kits for anyone that's on the road to make sure that they are safe.
Yes, and so many of our staff are visiting on the road, so it's a road safety repair kind of kit thing, yeah. And winter safety has always been a hot topic. So the safety committee has in-service opportunities where they're teaching, but they're also doing ongoing things like checking your ergonomic station, or if you see something, say something. We kind of have flyers around the office, make sure things are safe and done safely, and we have a really good committee of clinical staff and office staff who work on that safety committee. So that's Caring Hearts and Hands, Spirit, Safety, and then of course we have a wellness team. So we are moving in this year to talk about all those pieces of being wellness, but they are all separate groups of people working on it to really divide up our resources and keep everybody involved. But Traci, I brought you here today to talk about the wellness team, how long it's kind of been in formation like it is, and what kind of things the wellness team brings to the agency.
Sure. So if I remember correctly, I think it's been just under a year that the wellness team has been created. And we have got a relationship with Blue Cross Blue Shield through their Accountable Blue program, which has been fabulous to work with. They have been helping us to develop the health and wellness portal that we have for our agency staff to be able to access.
Online. Okay.
Online, yep. They've been helping us develop health assessments so that we can get a very clear picture of what our staff is feeling like the biggest needs are. So we've done these assessments and have maybe been a little surprised in some areas and not in others, but it's been able to give us an idea of where we should be focusing and what our staff is really feeling that the need is. Yeah. So it's been very valuable.
Yeah, I was going to ask you that. How do we gauge what staff want? You know, we could give all sorts of wellness topics, but it's important to ask staff and engage them and say, what's important to you? So we have done that through a couple surveys, and they've helped us. So you don't have to reinvent the wheel. And
exactly.
Yeah, we can ask what staff want.
Yep.
Yeah.
So
we should mention Blue Cross Blue Shield is our insurance provider as the agency right now. So we are fortunate to be a part of that Accountable Blue, which helps us fund a lot of these activities.
Absolutely.
So we are very fortunate to have a budget for wellness, staff wellness. So.
Yep. And through that, we've been able to do gift cards for some of the local food stands and some of the sports shops and that sort of thing that have just given a little bit more of a healthier focus, but keeping it local. So we're also supporting the local businesses.
And you're talking about incentivizing some of the programs and
Absolutely.
campaigns we've done.
Yes, we've done some programs to help folks identify goals and what are some small goals that they can make, and by completing those campaigns that we've done, they get entered in for drawings. Everybody has received water bottles for those that have chosen to participate.
Those water bottles here. Oh, and we have a logo.
There we
go.
Kind
of fun wellness logo for home health.
So we've also done some work with Rise Vermont, and they've been wonderful to work with also. They have also worked with us to help create our vision and mission and what we want wellness to look like in the office, and they provide many good activities through the community that we promote for staff to be able to participate in as well. So
yeah, and Rise Vermont, we should mention, we were recipient of the Rise Gold level because they do different levels, and part of what brought us to that was breastfeeding friendly location, and then the smoke-free campus. Can you talk about that?
Yeah, so we've been working with Northwest Medical Center Tobacco Coalition, and they have helped us develop our smoke-free or tobacco-free policy through the office and help to provide resources and supports for our individuals and family members that are wanting to make a quit and make a change. So they have been a really good resource and support, and also providing some incentives for people that are wanting to make that change and wanting to make those attempts. They have been able to work with us to provide some incentives to help encourage.
Yes. And when you mentioned the tobacco policy, just remind folks that part of updating our tobacco policy was to go to a complete tobacco-free campus. So if you visit the agency, you'll see signs that it's a smoke-free campus.
Absolutely.
Once you hit our parking lot on. So yeah, we're really proud of that. We want to encourage healthy air for everybody. So that was a good measure for that. Yeah. So and other things with the wellness team that we have coming down the road.
I'm trying to think what we've got coming up. We've been able to purchase some books, which you have there, that folks within the office can borrow and look at. We've purchased, I believe we've been in the process of purchasing some small pieces of equipment that can be borrowed, loaned out so that folks can give a try. We've been doing some talking about possibly pulling together some groups. We have many of our staff members, or a few of our staff members anyways, engage in a walking group at lunchtime, so trying to promote some of that to continue, and just again encouraging people to take advantage of the resources that are within the community.
Yeah, there are so many wonderful community resources, which we are so focused, rightly so, in worksite wellness on our staff, but we also want to encourage and educate their families, and Rise Vermont is a great source for that locally. And of course, people can find information about them online. So any other things you'd like to add about wellness at Franklin County Home Health Agency and how it relates to your job and how you do your job?
I think it just, it has given us a broader perspective on what wellness needs to be. And I think through our staff voices, through the assessments we've done, we've gotten a better idea of what the issues are that people are dealing with, and trying to then help figure out how to put the resources and services in place to help with those. And I think it's nice when we're hearing from the staff as to what they're really wanting, and trying to support all of us in that way. So,
exactly. Yeah, and some of those, we just did a survey, sort of asked staff what did they think of the past year and what kind of things they'd like to see come through. And this is just a small portion of some of the books we had, and one of them was about sleeping well, because it turned out that was one of the top, surprise, people want help with sleeping better, because it definitely impacts your whole overall health. So we'll try to do some education and in-service around that. Eating well, of course, and then gym memberships was a top one too. So we're looking into, relationships with gyms to offer discounts or see what we can do for staff with that as well. So a lot of exciting stuff. I'm glad that the agency's leadership supports it.
Absolutely.
And that we have so many engaged staff members. There's quite a number, 7 or more people on each committee who, across all disciplines are working together to support their staff, coworkers. Another fun one we should mention is the garden.
Oh yes, we did do a garden last summer, and plan to do again a community garden for the agency, and staff are welcome to plant and welcome to reap the benefits of that.
At it like a healthier version of the vending machine.
Yeah.
And I just, again, thank you both for all that you do at the agency in your work and in your staff committees. It's extra time, but it's really well received, and we appreciate your work. So thank you.
Thank you.
And just with a few minutes left, I just want to remind folks that they can call Franklin County Home Health Agency at 527-7531 if they have any questions about maybe starting worksite wellness at your place of business, and we'd be happy to talk with you about what worked for us and some resources for you. But you can also call us or check us out online anytime if you want more information about the home health and hospice services we provide. And you can like us on Facebook and stay up to date with community events and activities that are offered by the agency. And again, you can find us at www.fchha.org. And I just will make a plug for an event coming up down the road a little bit. Will be town meeting days are happening in March, and we just want to encourage folks to take the time now to make sure you're registered in your town or get an absentee ballot if you can't get out. It's very important to us for those who go to their towns and see the requests that Franklin County Home Health Agency has in each town for funding. It's a huge support for us to receive funding from each of the towns that we serve, and we have offered information on our website for you to find out exactly what kind of services, how many people we're serving, what the dollar amount has been for serving in your town. So I encourage you to check that out, and if you have any questions, please do call us at 527-7531. Again, thank you for watching today, and be well.